demonstrate how to access and submit clinical information and support patient participation in the National Bowel Cancer Screening Program. Once you search for your patient and selected their bowel screening record, you'll see the corresponding tab on the main banner menu. If your patient is eligible for the cervical program, a tab for that will also appear, allowing you to switch between the two. At the top of the screen, you'll find key identifying information, the dates and status of their last and next screening actions, and where relevant, any alerts corresponding to the patient's screening status, which can be viewed by hovering over them. In the Forms tab, you can submit clinical information and access previously submitted forms and results. Submitting clinical information for your patients is crucial and helps to ensure that patients are placed on the correct screening pathway and receive timely reminders in follow-up. Without it, delays in care may occur, and our follow-up team may need to contact you if a patient has a positive result. The following forms and reports are available for the National Bowel Cancer Screening Program. Please note, some forms may not display, depending on the patient's screening pathway. This list represents all available forms, not necessarily those for the test patient in this demonstration. GP Assessment Report. For doctors to provide information about a consultation with a patient who has received a positive FOBT result. Colonoscopy Report. For colonoscopists and GPs to report the results of a colonoscopy procedure for a patient with a positive FOBT result. Adverse Events Report. For GPs to report on an adverse outcome for a procedure relating to your patient. Histopathology Report. To report the results of tested specimens collected during the colonoscopy procedure for a patient with a positive FOBT result. Healthcare providers play a key role in encouraging patients to complete the bowel cancer screening test. You can request an FOBT kit be mailed to your patient if they have lost, misplaced, or damaged their kit, or it is expired, or they are aged 45 to 49 and want to receive their first kit to join the screening program. Once completed, they'll automatically receive a new kit every 2 years. Through the Alternative Access to Kits model, healthcare providers can bulk order free bowel cancer screening test kits and issue them to eligible patients during an appointment, and provide a replacement participant details form for the patient. This process is detailed in our other video guides, bulk order bowel screening test kits, and issuing a bowel screening test kit to a patient. The replacement participant details form request generates a new form to be delivered to your patient's address if they have misplaced the one provided to them with your kit. You can also submit the following forms to manage your patient's participation in the bowel program. Defer bowel program. To change the date of your patient's next screening, perhaps because of travel or other reasons. Opt-out bowel program. Your patient can resume participation at any time via the participant portal or calling the NCSR. The Correspondence tab displays all screening program-related messages sent to your patient, including when bowel screening test kits have been sent to them in the NERF. The Participant Details tab displays demographic information which can be updated, including name, address, and contact details. Updating these details will not change your patient's details held in Medicare. Nominated healthcare provider, which can be updated for either program your patient is participating in. Nominate a personal representative, to give authority to a friend or relative of your patient to perform actions on their behalf in the bowel program. And Indigenous and country of origin details. The Notes section allows you to enter and view notes specific to your patient. Only the notes you add will be visible to you. To find out more about the National Bowel Cancer Screening Program, visit Health.gov.au/NBCSP.